Imagine the universe we know. It's vast, mysterious, and governed by immutable laws that we are only beginning to understand. One such law, Boyle's law, plays a crucial role in a phenomenon known as decompression illness, or DCI, which can have serious consequences. This condition, which affects both divers and astronauts, arises from the complex interplay between pressure and the human body. As we descend into the depths of the ocean or ascend into the vacuum of space, the ambient pressure changes dramatically, affecting our physiology. These pressure changes affect the solubility of gases, particularly nitrogen, in our bloodstream, which can lead to serious health issues. Just like a bottle of soda fizzes when opened, releasing dissolved gas, our bodies can experience a similar reaction when pressure changes too rapidly, causing nitrogen bubbles to form. This is the crux of decompression illness, a condition that can be both painful and dangerous. When a diver ascends too quickly, the dissolved nitrogen in their blood can form bubbles, which can be life-threatening if not managed properly. These bubbles, akin to tiny embolisms, can obstruct blood flow and damage tissues, leading to a range of debilitating symptoms from joint pain to neurological issues. Understanding the causes and consequences of DCI is paramount for anyone venturing into environments with fluctuating pressures, as it can save lives. Whether you're a seasoned diver exploring coral reefs or an astronaut embarking on a spacewalk, awareness of this condition and proper precautions are your first line of defense against its potentially severe effects. Decompression illness, much like the vast universe itself, encompasses a spectrum of possibilities. It manifests in two primary forms: decompression sickness, or DCS, and arterial gas embolism, known as age. Though both stem from pressure changes, their mechanisms and symptoms differ significantly from each other. DCS, often referred to as the bends, arises when nitrogen bubbles form within tissues and joints. Imagine these bubbles as tiny disruptions in the intricate machinery of our bodies, hindering movement and causing significant pain. The severity of DCS can range from mild joint discomfort to life-threatening neurological impairments. Age, on the other hand, presents a more immediate and potentially catastrophic threat to divers. In this scenario, nitrogen bubbles invade the arterial bloodstream, blocking blood flow to vital organs, including the brain and lungs. The consequences can be dire, leading to stroke-like symptoms, paralysis, and even death in severe cases. Distinguishing between DCS and age is crucial for prompt and appropriate treatment. While both conditions demand immediate medical attention, understanding their unique characteristics can guide first responders and healthcare professionals in providing the most effective care possible. While the allure of the deep blue or the celestial expanse beckons many, it's essential to recognize that certain individuals are more susceptible to decompression illness, also known as DCI or the bends. Just as stars have different masses and lifespans, humans possess varying levels of vulnerability to this condition, influenced by factors such as age, fitness level, and even genetics. Divers, particularly those who engage in deep or repetitive dives, constitute the largest group at risk. The repetitive exposure to high-pressure environments significantly increases their susceptibility. The longer and deeper the dive, the greater the amount of nitrogen absorbed into the bloodstream, increasing the likelihood of bubble formation upon ascent. This is why dive computers and strict adherence to dive tables are crucial. Astronauts venturing beyond Earth's protective atmosphere also face the risk of DCI. Their unique environment poses challenges similar to those faced by deep-sea divers. During spacewalks or extravehicular activities, their spacesuits maintain a lower pressure than the International Space Station, creating a prime environment for decompression illness to develop. This is why pre-breathing protocols are essential before spacewalks. Certain pre-existing medical conditions like heart defects or lung diseases can further amplify the risk of DCI. These conditions can interfere with the body's ability to manage pressure changes effectively. These conditions can exacerbate the body's response to pressure changes, making individuals more susceptible to the formation of nitrogen bubbles. Rapid ascents can be particularly dangerous for these individuals. Understanding your individual risk factors and adhering to safe diving practices are paramount for mitigating the chances of experiencing this potentially debilitating condition. Regular medical checkups and proper training can make a significant difference. The human body, a marvel of biological engineering, often communicates its distress through a symphony of symptoms, each one a signal that something is amiss. Decompression illness, or DCI, is no exception to this rule. Recognizing these warning signs is crucial for seeking timely medical intervention, which can make all the difference in outcomes. Symptoms of DCS typically manifest within hours of a dive, though in some cases they may take up to 24 hours to appear, making it essential to remain vigilant. Joint pain, often described as deep and aching, is the most common symptom experienced by divers. This pain, primarily affecting the shoulders, elbows, hips, and knees, can range from mild discomfort to debilitating agony, impacting daily activities. Other symptoms of DCS include fatigue, dizziness, skin rash, weakness, and tingling sensations, which can be easily overlooked. In severe cases, individuals may experience paralysis, loss of bladder or bowel control, and even unconsciousness, necessitating immediate medical attention. Age, on the other hand, presents a more dramatic and immediate onset of symptoms, often within minutes of surfacing, making it even more critical to act fast. These symptoms often mimic a stroke, with sudden weakness or paralysis on one side of the body, difficulty speaking, confusion, vision disturbances, and seizures, adding to the urgency. Prompt recognition of these symptoms is paramount for effective treatment. Time is of the essence in treating DCI, and delaying medical attention can lead to permanent neurological damage or even death, underscoring the importance of awareness and quick action.